All right, good afternoon. Thank you guys for being here. We appreciate very much you sharing a little bit of your afternoon with us, and I apologize for us being a few minutes late. We were taking care of some last-minute technical things that we needed to try to make sure we're available for you to get the full effect of what we talk about here today. Columbus, like almost every other city in the country, has been experiencing a spike in violent crime. And although our police department, our sheriff's department, they all work very hard to continue to innovate and do a great job of not only investigating and nabbing these folks that are committing the crimes, but also they work very hard to try to build a good, solid case so that they can separate them for their freedom for what they've done. But that's not the whole answer. We also understand intellectually and sociologically that we desperately need intervention as well. We need something to stop the food supply of these young people who, for whatever reason, are turning to negative activities and creating a lot of challenges. So council, at the last meeting, authorized $25,000 to have an assessment performed by Cure Violence. And Cure Violence is an organization that you'll hear a little bit more about in just a second. But it's an organization that has been around a while, and they attack violence as you would a disease. And the individuals that have been working so hard on this for well over 2 years, just citizens from our community, are here to try to clear up some misconceptions and try to answer any of your questions. Now, I'll tell you today, we have our city manager, Isaiah Hughley, here. We have our sheriff, Greg Countryman, our police chief, Chief Blackman, Seth Brown from our crime prevention division, and we've got Councilors Crabb and House. So if you have a question, either here from the media or if you're watching on YouTube or Facebook Live or on CCG TV, feel free to ask the question. I think we've got the people that can answer it. The individuals that are here that have been studying this for so long and have brought this forward are here today, and I'm going to turn it over to them, get out of their way, and I want to introduce first Cedric Hill II. He's going to start off, and then he'll, I guess, pass it to the rest of the group.
Thank you, Mr. Mayor. Thank you for the opportunity to be here and share this program with you. I just want to introduce us to you before we get started. My name is Cedric Hill II. We also have with us Dr. Asante Hiltz. She is the program manager for the West Central Health District here in Columbus. Also Cedric Hill Sr. and Reggie Lewis as well. And also not with us is Dr. Ashley Hill, who is an epidemiologist from Columbus as well. And Dr. Asante is an epidemiologist, which lends itself credibly for our program that we're trying to do here. So just a quick introduction to Cure Violence. Cure Violence is a community-based, data-driven violence intervention program. And it addresses violence through the lens of public health, as you heard Mr. Mayor just mention a second ago. And so partially what that means is that we're kind of seeking to shift the view of violence from solely bad people doing bad things to looking at the adverse circumstances that contribute to the transmission of violent activity. And so it's a bit of a unique way of attacking violence, but we're looking to have this collaborative approach to putting this program into play. And so we're looking at holistic community improvement. So when you look at the areas that have high violent activity, you look at the fact that they have low access to education, low access to health care. They're very underdeveloped areas. And so when we talk about collaboration, we appreciate the fact that we have representatives from law enforcement here. And we also are looking at other community partners that are working at some of these things in our community already to be a part of this team, because it is a holistic, collaborative effort that it's going to take for us to be able to implement this program and to get it off the ground and see some real tangible change in our city. And so I just want to give a couple of numbers based on how this program has been implemented in other cities and in other nations, because it's a global program that's worked really well in some places. So in Baltimore, they saw a reduction of 56% in as far as killings and 44% in shootings. In Philadelphia, they saw a reduction of 30% in shootings. Chicago saw a reduction of 48% in shootings. And there was one site in Honduras that went 17 months without a shooting. And so these are the types of results that we are hoping to be able to bring to the Columbus area. And we genuinely believe that we can cure violence in this city and make it a place that's better for all of our citizens. So with that being said, I'm going to pass it over to Dr. Hiltz, who is an epidemiologist, is going to talk to you some more specifics about how this program functions and how it works.
Thank you, Cedric. Thank you, everyone, for being here today. I'm going to just share some details about the Cure Violence program, and I'm not going to spend too much time going over all of the information because I want to leave enough time for you to be able to ask us some questions. But I just want to add to some of the statistics that Cedric has shared, and that one statistics that come from the Center for Disease Control and Prevention is that gun violence is the leading cause of death for young black males aged 15 to 24. That's the leading cause of death right now. And from a public health standpoint, we target leading causes of death. And traditionally, violence is not seen as a health problem, and it's traditionally not taken a health approach to that problem. But we are going to treat violence as an epidemic in the same way that we treat other epidemics. It's wonderful, that's not the right word, but since we are in the pandemic right now, it lends itself to a wonderful parallel as to how we are addressing the current COVID-19 pandemic, because it shows you the epidemiological strategies and steps that need to be taken to address an epidemic. And that is, we detect what the source of the disease is. For violence, we're looking at that as a disease. What is the source? How can we detect that and interrupt it? And that's one of the core components of the Cure Violence programs. We detect and interrupt the disease of violence so that we can get ahead of it. Number two, you want to prevent disease occurrence. So we want to prevent violence. How can we get credible messengers, or as we call it in the program, interrupters, who can step in, identify violent acts, identify retaliatory opportunities, and stop it before it starts? Number three is data-driven. We utilize training from the Cure Violence Global Program. So people have said, why should an external agency come into our community to assist us with our violence program? It's because this program has credibility in many different locations, and because it's an evidence-based strategy, that same strategy can be brought to Columbus and utilized here. That's why we're bringing it here. We're using the Columbus data, Columbus community organizations, who are all going to feed into our solution to this problem, the violence problem that we're treating as an epidemic. So I just want to touch on a couple other points of the program. We are going to, using the Cure Violence Global model, provide ongoing behavior change and support to the high-risk individuals through trained, credible workers. In other situations, when it comes to health, we call them community health workers because they're addressing a health problem in the community. We're going to use the same people in our communities who are credible, who may have been a part of gang violence in the past, who may have been away and incarcerated and came back into the community, but they have credibility. We're going to utilize them in their own communities because they have credibility to detect, interrupt, and stop violent acts. The third thing is we want to change the community and group norms so that we can allow, encourage, and exasperate violence in chronically violent neighborhoods. And we're going to help them make healthy choices and reject the use of violence. That's one of the strategies that has been proven effective with Cure Violence Global in the US states as well as in other countries. We're going to replicate that program here. The external partners who are coming in to assist us are going to take some of those grassroots organizations, our city partners, and they're going to come together and come up with solutions that are tailored and specific to our Columbus neighborhoods. And that's all that I have in terms of Cure Violence specifics, and I'll be available after to answer questions about the model. Thank you.
Good afternoon. My name is Reggie Lewis, and I'll be talking about the assessment. We know we've had a lot of questions dealing with the assessment and what that is dealing with. And a few of the things that we want to talk about, the assessment is not simply like a week-long event. It is a 2 to 3 month event. It involves almost 15 different meetings or units that goes through what Cure Violence is about. It also talks about a debriefing of the data. And that's one of the key components that we're talking about. So
one of the things that our team has been doing, we've been reaching out to Piedmont Hospital, the Sheriff Department, the Police Department to bring in data, to identify the different trends that may be available in our community. And one of the things we found just from like January 2020 to February 2021, we had almost over 1,500 different assaults that included stabbings, rapes, gunshot wounds that went through Piedmont North and Piedmont Midtown. And of that, the cost associated with that was in the millions. So you want to think about what we're impacting is reducing that cost. We have almost $3.4 million invested in some of these gunshot and some of these assaults in a one-year period. That's greater than anything I've thought about when it comes to violence in our communities. When we're having 200 to 300 different shootings every month, that's not including the murders. That is just shooting events. That's in a one-year period. Over 272 of those have occurred. And then we talk about the domestic violence, the rapes, and other assaults that occur that add on to that total. But that's what we're trying to focus on and what we're trying to do with the assessment. So the assessment will bring in several different things important to us. And sorry about the writing, but one of the things that we want to talk about is the Cure Violence Assessment has a Cure Violence workshop. That will be between 1 to 3 meetings because of the number of people that will be involved in that. So that will talk about basically what we plan to do, what Cure Violence is, how does it work, what's the methodology behind it. It'll also go through the roles and responsibilities of our community-based partners and also as well as community leaders and community itself will be involved in that process. We also look at the target area. That is a week-long process where we actually go on site to the different target areas. Our investigation as far as our team has identified the 31903 as being one of our leading target areas, followed by 31906 and 31907, which is our east end area, our south end area, and our midtown area. So those are the areas that we identified just from the work we've done over the last 2 years. The next piece is official review meeting. That official review meeting is basically where we're sitting down and going through all the data that was collected, and as well, they're coming back with what is the pre-implementation, what is the implementation. Also, they also help us understand what will be the challenges to us as we move forward. What are some of the responsibilities of our partners in our community-based organizations, as well as the cost is what everybody's looking for. The next part is, as part of this assessment, we also have an individual community partners meeting. And what that is involved is community partners, community-based organizations, and people from our community come together, and these partners, along with hospital law enforcement, we look at the data, and the Cure Violence Global team basically goes in and listens to us to see what's going on in our community. So the community-based organizations will be a very vital part to this because they will be able to bring some of the things that we may not see just in the data. The data will tell us a story, but this will be the confirmation part as having the community-based organization there. They can provide the confirmation that this is what we see in the data and this is actually true. And then we talk about the potential workers. Cure Violence model uses outreach workers, it uses violence interrupters, it uses program directors to facilitate and move through with implementation. We're under the health department at this point because we will be the coordinating implementation agency that come up with different solutions, but the outreach workers will be the ones that are keeping up with the events that are going on in the community. We will run a database. That database will allow us to keep up with anniversary dates when someone is getting out of prison or when an event occurred to ensure that we don't have any retaliatory events. So that is a key one because that will help us identify who are the right people for the job because we want to make sure we get this right the first time and not have any failures. Yes, what we've seen in some of the evaluation of studies like in Trinidad, Tobago, they had some issues with their implementation. A lot of it was dealing with leadership. A lot of it was dealing with they were not keeping up with the data as they were supposed to. It is very key that we keep up with that information and that we share that information because we'll have yearly and annually do reviews to ensure that we're headed in the right direction and making an adjustment as we move forward. Then we talk about the hospital trauma center meeting. That is very key because one of the areas that we will need outreach workers are in the hospital. This is for the shooting victims that come in, and when talking to Piedmont, they were basically saying, look, guys, what y'all think is COVID taking up most of our emergency room? No, it's gunshot wound victims. That is a big piece of it. And what that is to help those who are at high risk to try to get them out of that high risk area and move them into a lower risk and be more prosperous in their community. That is the idea behind that hospital trauma meeting. And then the virtual assessment visit is just a report that they come up with that tells us all the information that they've looked at. And then we'll have 1 to 2 debriefings that will occur as well, along with what the implementation site should be. And if it's citywide, is it individual neighborhoods or what the hot spots are? And then that will, in turn, give us the cost. So right now, that's what we're waiting to try to do, not waiting to do, but that's what we'll be scheduling for the May timeframe to ensure that we can get out. Over the last 2 years, we've had meetings on our own to talk with the communities, to get back with the community-based organizations, because I know there was a lot of questions thinking that we were the only ones working towards this. No, we're not. We had several meetings, and then COVID hit, which made us, we were not able to keep continuing to have these meetings. So that's what happened, and so that's why if we haven't talked to you yet, it was not because we were not trying, it was simply because we ran into COVID and all the restrictions associated with that. But we are still trying to continue to do that. We will have to go more virtual now to get those community partners on board to talk more about the program, but we need you to be part of that assessment. We need you to come forward and talk about the things that you're seeing in the community as well, because we want to ensure when we do this, if this is the right fit, and I say the right fit because Cure Violence Global actually interviews us as well. So if they don't think it's the right fit or don't feel like we are willing to abide by their implementation and try to follow what they've set forth as the guidelines, they will not go with us because they want it to be done right. And the funding and the money that we talk about does not go outside of this community. It stays in this community. This is not something we're paying Cure Violence Global to do for us. We're the ones that handle the process. We're the ones that handle the implementation. Cure Violence Global is our consultants and our support. That's what we need, to ensure that we are doing it right, to ensure that if we need to change anything, how do we change it, and to ensure that if we have any questions or any issues that we get those addressed. So we will have technical support every year. So even for our workers, they provide training, 40 hours of initial training for them, and then it'll be like 25 hours every year going forward to make sure they stay up to speed on the new technology. So the other part on this is identify the CBOs that I've talked about earlier and talked about the partners. That is key. And then the last time is one of the things we were looking at in our program, in the roadmap we have, this was our roadmap, and this is what we were looking to try to implement in the fourth quarter of this year. And like I said, COVID kind of pushed us back a little bit, but we still think we have an opportunity to do that. But out of that assessment, we will get those answers and get that information. So I'm going to stop right there. I don't know if any questions that I can answer. Yes, sir.
Yes, sir. Adrian Chester, and thank you all for being present and the work that you all have done leading up to this point. I guess from an initial standpoint, how do you all envision, or what are other models from Cure the Violence of how churches and ministers have been utilized to be a part of the equation, and what is you all's projected expectation of, I guess, churches and ministries in this work moving forward?
Right, good question. So one of the things that we see with the faith-based community is that they're usually in the center of those communities. They're the places where people come to get information. One of the things that we're looking for faith communities to do is basically be the location for resources. Because one of the things that we're talking about, and you heard Dr. Asante say it, is we've got to get back to the seed of the issue, not violence. Violence is the end result. So one of the things we're going to talk about is we know that in these communities, a lot of people don't know about the resources we have in Columbus. So the churches and things will be a good avenue for, we'll provide you information as far as what's available from resources, dealing with education, dealing with mental health, behavior, food, poverty, homelessness, all that stuff, and make sure you have a database so you can go out, if somebody comes to your facility and needs a resource, you'll be able to provide them several options for that. So that's one of the things where the faith-based community comes into play, is because you're basically in the heart of the community. And so that is usually where they first go to, they ask for help or need information. You'll be able to provide that to them because you have that connection. Yes, sir.
So, I guess a follow-up question to that, specifically here in Columbus, there have been organizations and individuals who have been boots on the ground, per se, those grassroots organizations, such as, Project Rebound and others. Will those persons be included in these conversations? And how do you, I guess, what's the vision to make sure that those collaborating partners who've been doing the work are not excluded from the opportunities now if they so choose to be a part?
Right. So this is not an exclusion. We need every grassroots organization, and that's what we were starting with the meetings that we had. We were trying to get those grassroots organizations up to speed on what Cure Violence was. And the reason why is exactly what you said. They're boots on the ground. And so one of the issues that we saw, though, in some of our meetings is that when we asked a question or people would ask us questions, a lot of it dealt with they didn't know these organizations existed, even the corporate level organizations. They didn't understand they existed. At one particular meeting, I asked a simple question. Does anybody know what Valley Health Services offers? And out of 35 people, only 7 people raised their hand. And they have this facility in their community. So what that was telling me is if you don't know the big organizations, you're probably not going to know the grassroots organizations. So the purpose of us is to ensure that we bring to light all organizations from grassroots all the way up to corporate level, and to make sure everybody knows who's available, what they offer, how to get in contact with them, but also make sure that everybody's included. We have to collaborate on this. This cannot be a solo project. That is not what we're about. We're about bringing Columbus holistically together to have a collaboration that basically addresses the issues, because this just didn't happen in one day. As a police officer for over 10 years in this community, I was back in the 90s. I understand what was going on. So we've been having this problem for a while. It just didn't start. So we need all boots on the ground at every level to make sure we are successful at this process. Any other questions?
Hey, we have a question from Facebook asking if you're going to work in the Bibb City area as well.
Right. The assessment will look at the entirety of Columbus. It will not simply be, South Side. But what we're looking at is we're trying to identify the areas that are impacted the most. And then as we move forward, we will probably have additional rollouts as time permits. But that is the key thing. That's what that assessment will tell us, is probably give us a priority. Because we definitely want to go after those areas that were impacted the most and try to get those under control, and then also look at what we can implement in the other areas like Bibb City and some of the other areas.
Is it on? Okay. How will the assessment help our community make sure that the eventual details of the recommended program will be tailored to our community? I know you kind of mentioned that, but could you bullet point that?
Right. So that's what I was talking about, the data review and the debriefing. In that section is where we bring the data from the hospitals, we bring the data from the law enforcement, we also bring data from the community-based organizations and the community themselves in front of Cure Violence Global, so they can hear the things that we are seeing and are being exposed to. They will take that along with their target visit and come up with a tailored implementation for Columbus, Georgia. And that doesn't mean that the implementation will be one holistic implementation where Casita, Bibb City, East Side are all covered. They will be individual based off of what they see. So we could have 3 different implementations for 3 different communities. So it's not necessarily one size fits all. It's all about the information and what it proves to be.
So what can citizens do to help this process? I know you said that it was as if this company is interviewing our community too. What can citizens do to help? And how do they get involved?
Well, one of the things they can do is just come forward and provide information as best as can, what we can't see all the time. You know, the data is going to provide a lot of it, but it's going to provide kind of what's happening. But we also need to understand why it's happening. What's the seed that's causing violence or causing different issues in the community? Because, you know, what we've seen sometimes from the top or from the outside, we don't always see what's on the inside. So contacting us on our email addresses at, West Central Health Department, providing us that information, we are happy to sit down and talk with them. We have a Cure Violence Columbus, Georgia Facebook page that you can message us on and contact us, and our emails and information is on there as well. But they are important to this as well.
At city council meeting, you had a slide, that. Would you explain that to us?
Right. The slide that is being shown is what we call the big picture. And the big picture is the nucleus of what we're trying to accomplish in Columbus. As you can see, specifically, the focus in the middle is the community, and the community is basically leading the local movement. That's what this picture shows. And around it, we surround them with the partners that have the different resources, like you'll see the Academy Medical Centers, the faith-based institutions, community information systems, law enforcement, and at the top you'll see the Public Health Department, which is basically the coordinated implementation solution for cure violence, and then the schools of public health. These are all key and have to be in place for us to be successful because they provide different levels of resources, but they also address different things that we'll be tackling, dealing with the social determinants of health. So you talk about education, you talk about health, you talk about economic development. We have been discussing with Gerald at Columbus Chamber about economic development, what are the things we can do from there. Also talking about public safety, and when I talk about public safety, I mean safety in those neighborhoods where they can be out and walk around. So that's what this picture kind of depicts and kind of gives you an idea of what the responsibility of the organization. Yes, sir.
Yes, I'm Dr. J. Alina Hood, and with 92.1 FM broadcast. Our question, the preliminary report, that assessment that you all provided to the Cure Corporation, that I guess a proposal for them to come in or what have you, is that document available?
Yeah, so we haven't provided anything as far as the assessment documentation and data that I was talking about. We've been collecting it, what we've been talking through. So the Cure Violence Global has a process. So they give us information on how we need to go about trying to get people involved in it, but also understanding what we need to collect as that data. So we haven't provided any data to them. We've just been in discussion with them to make sure we're on the right path as far as getting prepared for an assessment. And so once we get all the data, we will then provide that. But yes, we're more than happy to start providing data to anybody who wants to see it so they'll understand what we're seeing.
Okay, so when you said that they interviewed you, you made this just a conversational interview with what's not in the documentation?
Right, so what I was saying in the interview earlier was saying during that assessment, they will be doing their own interviewing and doing their own investigation to who we are. Okay. Now, we did have a one-on-one meeting with them, with our team and two of their representatives, and that was kind of an interview as well. But holistically, there will be an interview of all the community partners, community-based organizations, and the support that we will have at that assessment. So during the assessment, you probably be getting interviewed as well.
Let me just also say that I hope that, first of all, I'm delighted to know that it is the public health model. That is a model that's been in the making for some time, and that with the media here, and in our case, we have a talk show, we would hope that you would utilize that because there's a lot of misinformation, a lack of information, right, that's occurring. So I think that when we can have a dialogue like this so the public can actually hear engaged, on those instruments of broadcast as soon as possible. Yes, because the sooner the better, then that way some questions won't ever come up at all. Yes, so I would suggest that, that we get started so that people will be clear about what they're embracing as soon as possible.
Absolutely. Thank you, sir. have any other questions?
I know that you have a little bit touched on this, but I have heard a lot, and I would love to give you an opportunity to say, what do you say to people who assert that we don't need to bring in an outside company to fix our violence issue?
You know, working in the corporate world, working in the banking industry, one of the things I see is a lot of times that we don't know everything. And sometimes somebody has done it better. And in this situation, we have somebody who's been working on this since 2000, has implemented in over 100 cities in 10 countries around the world, and different implementation segments for that regarding either domestic violence, gang violence, shootings, assaults, and rape. And what we've done and what we saw was when we started investigating it, we were very hesitant as well as far as how can they help us. But after all of us meeting in a divine situation where we were brought together, we were able to really see that the program had a good foundation for us to be successful. And one of the things that they said to us is they want to ensure that anybody who implements or agree to implement one of their models, that they're successful. That is their business. But they are coming here to help us get set up, and everything stays internally here. It is simply their consultants. It's like a doctor prescribing you medication for an ailment. You know, he's giving you the examples. It's up to you to implement and stay focused on that regimen that he's provided to you. So, you know, for us, it's why not look at something that's been tried and true? Yes, they have success. You know, we know that in Trinidad, like I mentioned earlier, that they had some issues, but that's what they are about, is making sure you understand the pitfalls, but also you understand the challenges. There will be challenges in this scenario, so why recreate the wheel? As some of the gentlemen said, we already have grassroots and boots on the ground organizations. We're not trying to recreate a wheel. We're trying to collaborate and bring everybody together, but also look at ways we can take advantage of something that's already in place and make it work in our community. Any other questions? Right, I'm gonna let Cedric Senior come up and close us out if that's okay.
Thank you, Reggie. Thank you all for the opportunity of being able to share with you today. This is just a brief segment, realistically, of Cure Violence. We've come to call it, or I do, it's like a university. So in essence, what we've got to do is we've got to go to school as individuals here. And it's been identified that this will be a heavy lift in Columbus, and we realize that. So if we use that analogy as we've done with our health perspective, whenever you got a heavy lift, what you try and do is you get as many people as you possibly can to help you do that lift. So that's our appeal to the citizens in the city of Columbus, Georgia. If you're doing anything in Columbus that's improving the quality of life in Columbus, you fit this model. And we want to make sure that you know that. We want to make sure that you're a part of that, and we want to make sure that we know where you are. We can't meet enough because, as Reggie talked about before that, we were in either churches or the sheriff led us to several different places, and we're still in that posture. Anywhere we can go where people are actually providing information and resources and help to this community, we want to be there. We thank you for the opportunity of being able to stand before you. I'm honored and blessed to be a part of a team such as this that has a heart for this community. And our theory and our theology is this: we together can cure violence in Columbus, Georgia. If there are no further questions, I think we'll be... Okay, I'm sorry.
Sorry, I got another question. So we have a question about operational costs and return on investment to the community. And are resources available in this program to provide employment opportunities for the target population?
Those are good questions. Quick answer to that is yes. But much of what we're not wanting to get the cart before the horse is that the assessment is realistically going to be our, if you will, report card. but it's also going to be our roadmap. So in essence, what the biggest picture, or the big picture for us at this point is to push toward that assessment, and while we're pushing toward that assessment, gain the momentum of the partners that we have in Columbus, Georgia that are doing great things.
Any other questions? Yes, sir.
He says, how do we reach?
Yes, sir. Yes, sir, we can be reached. Oh, let me see if I have it. Here's our emails and information up here. Like I said, we have a Facebook page, Cure Violence Georgia, Columbus, Georgia. We also are under the Health Department, West Central District Health Department, and we have links on our Facebook page to go to that page, and it has our email addresses and phone numbers as well. And if afterwards, I can provide them to all the media and everything, information that, make sure you can put it with just any kind of stories that you may have. Any other additional questions? Yes, ma'am.
She asked, are resources available in this program to provide employment opportunities for the target population?
Yeah, so it's part of the resources. Yeah, it's part of the different resources that sorry. So one of the things that we were looking at is employment and looking at different things. So to give you an example, one of the scenarios we looked at was what we call a reentry program for those coming out of prison or even in the juvenile justice system. Right now in the state of Georgia, we have 21 certificate programs that fall underneath the Georgia Technical College System. Of these 21 certificate programs, they're seeing a 98% employment rate, right? And they're everything from electrician, plumber, construction work, HVAC, diesel motors. Up in Gainesville, they actually have a linesman course as well. So, Bell South, Georgia Power, and things like that. So we are working with different partners. Goodwill has a job opportunity program and all the different programs around that are already available. So that's one of the things we're looking at as a channel that we have to address as far as the jobs, because what we're seeing, we get a lot of times a question that people are saying there's no jobs, but there are. It may not be a job that you're experiencing, or you're missing your GED or something like that. So we have partners like Goodwill, who has a 15-week extensive program that requires 4 tests. And then you have Columbus Tech that offers a flexible program for receiving your GED. And one of the things we want to do in that process is create a specific channel where if somebody's looking for help, but they can't get a job because they're lacking a GED. So we get you in the GED program, get you through that, make sure you have a mentor, because what we're seeing is that once they take on any kind of new option or something, they go back to their community without any support. So we've got to address that. Secondly, if they go through one of these certificate programs like electrician program, and we want to look for partners who are electricians who can give these folks the opportunity to learn the knowledge that is needed to be a good electrician. But then what we want to do is set up a program where it outlines how to start your own business from beginning to end, meaning how you go get your business license, how you sign off for your LLC, what you got to do with the state, and all those deals, and ensure that they have the foundation to be able to go to school, get the GED, get a certificate, go work, but then also start their own business properly and quickly without the struggle of what we see. Because that's one of the things that we also notice in our investigation, that is very difficult for small business owners sometimes to navigate the road of starting my own business. So we want to ensure that we have that gap covered. So yes, we are already looking at those opportunities and trying to have that in place as well when we have the invitation. So that is part of the resources that we're talking about, is to ensure that we can cover all the bases of what we tout as the social determinants of health, where you live, work, and play, to make sure we cover all 6 of those. And the 7th one is violence, to reduce that. You're welcome. Any other questions? We really, truly appreciate everybody giving us this opportunity. And we hear and know that, unfortunately, COVID stepped in and kind of dampened some of our momentum that we had starting in 2019. But we are definitely persistent. We're definitely dedicated to see this through. We all have other jobs. You know, I work for Tesis. He owns his own business. She works for the health department. Ashley works for the health department, and then Cedric is a Connect pastor. We all have full-time jobs, but what we can tell you is that we were all brought together for a divine reason. You know, God has led us together to really do something about our communities. And most of us have been here, you know, for me, over 30 years. So we have some involvement and some investment in this community to see and ensure that Columbus is amazing, as the tagline says, and ensure that it's amazing from south side to east, north and west. Wherever it is, we want to make sure Columbus holistically is amazing. Yes, sir.
Would you just talk briefly about the end game in terms of cure this group? I mean, are you a 501c3 now? Are you expecting to be a 501c3, and will there be a structure? What's the end game?
Yeah. Our vision was, we sat down and did some investigation to what we want to be. You know, we looked at 501c, we looked at, you know, crime prevention, we looked at, you know, law enforcement, we looked at United Way, we looked at all these different organizations. And after we went into investigation and really understood what the violence model was about, it led us back to the health department. And that's why I said divine. You know, we met Dr. Asante, sat down with her, you know, gave her what we were trying to do, and she understood immediately. Because it is coordination and implementation from under the health department, we felt like it was best that we come underneath the health department. We felt like trying to do a 501c, like the questions are now, who are you? We would get that same view with trying to do a 501c. We wanted to be under somewhere where it adds credibility, but also had accountability. It had a structure that was already in place for showing where money is spent and what money is received, and we were accountable to the community. The biggest thing that we saw as far as the health department was most of the people that we're trying to address as high risk usually go to the health department. So not only was it a good place to have accountability, but it was a great place for us to be able to look at those who need or are high risk and be able to help them. So we made a collective decision to come under the health department, and our team is just basically almost like an executive committee that oversees everything, but is just trying to put everything together. That was the best way for us to do it, and that's what we thought was the appropriate way to do it. Right.
I mean, was this a grassroots effort that you guys started talking, or did the mayor or the city manager or somebody call you and ask you to do this?
Right.
What happened?
So Cedric and I, when I was a police officer in the 90s, I was a motor squad officer. I escorted funerals, and that's how I met Cedric. In 2016, I was in Leadership Columbus class, and Cedric was the chair of the board for the chamber, and he spoke at our Leadership Columbus class. And after that, we kept bumping into each other almost on a weekly basis, and so we said, hey, let's just sit down and talk. And at the time, I was doing a personal stylist business on the side, helping people how to dress, and I just got a sense that there was something I had to do back in the community first before I started my own business. And while Cedric and I were talking, we realized that we had the passion to make a change in our community. We just didn't know how. So what we tried to do was we talked with one of the community advocates in the community. He brought us 7 candidates, and we basically said, using our resources and boards that we were on, is there something we can do to kind of remove your roadblocks? How can we help you? And it was everything from transportation, poverty, homelessness, childcare. And so what we did was we looked at trying to get them into Columbus Tech, removing the fees and stuff, getting them in Columbus Tech to get them started. And out of that, we only had, one of the 7 really take advantage of it. So then we started sitting back and going, okay, we didn't do that right. What did we do wrong? Let's think about it. So over the years, it came through, and that's when we, out for the good, the bad, the ugly tour that the mayor had, we bumped into Dr. Asante. And after one of the events, I came home and turned on the TV and Cure Violence popped up on the screen. It was on the PBS channel, not a channel I watch. And so after talking with Cedric and really going back and doing the investigation, that's when we identified we thought this was a viable source for us to really cure the violence. And so once we presented that to Dr. Sante, Cedric's daughter Ashley was up in Pittsburgh at the health department. She was doing grants and working on things that talked about violence as a health. And she was like, man, there's all kind of things out there from the CDC, Department of Justice, dealing with violence as a health. And it just kept moving forward from there. And we just kept, there were things that were being placed in front of us that we didn't even know we needed. So that's how we came about. And it's been, like I keep saying, a divine passion.
Well, at some point, you got connected to the mayor's office.
Right.
And the city.
Right.
And it was something the mayor, I didn't know about you and what you were doing, and the mayor kept talking about it.
Right. So.
And he kept talking about it. And then finally, he got to the point that he wanted to stop talking about it and do something about it. And that's how it got on the city council agenda. And that's how you got funded the initial $25,000 with a set aside, if you will, of up to $500,000. If you do the Cure Violence Global and things work out, there's up to $500,000. And I know the mayor called to my attention that the city manager over in Savannah, who's a former city manager here in Columbus, Michael Brown, was proposing for the city of Savannah up to $500,000. Right. And we know that it's in 100 cities or so, but he kept talking about it, and ultimately got the council, you got the $25,000, you formed a partnership with the city, and there's up to $500,000 that the mayor would have to go back to city council to get approval to spend that $500,000, up to $500,000, if it makes sense. So I missed the part where you got connected to the city.
So how we got connected to the city was really part of our touring that we were talking about that was stopped by COVID. So what we started doing is calling city leaders and calling the community-based organizations that we knew of. I mean, we went to Overflow Barbershop, to several different barbershops around the area. We were meeting with whoever we could. Sheriff Countryman had a couple events that we joined in on just to kind of pitch what we were talking about and what we were looking to do. And one of our events, the mayor attended the event, and what we did was sat down and explain that to the crowd. I think we had 30 people there, and that's where it started. Then we sat down and met with him again just to kind of give him the same footprint of what we were trying to do. And that, we needed the city as a partner at some point once we got through all our investigation and analysis of what needed to happen. And so we just kept them updated on, a frequent basis just to let them know where we were and what we were doing. And then that's how everything came to the Tuesday meeting was, we were moving closer and we were letting them know. Our roadmap had us trying to get Cure Violence here in May or, April or May. And so that's how we came in contact with the city is through our touring, what we were doing before COVID, and then just the constant updates to the city.
Well, thank you, sir, you and your team for what you're doing. I think it's going to make a huge difference in Columbus, and it's a strategy, it's a comprehensive approach, a proven approach to dealing with violence. So thank you for what you're doing.
Thank you. Any other questions? All right, thank you.